The words cancer and colonoscopy are two things most people would rather never talk about. But here is the reality. Colon cancer is the second leading cause of cancer-related deaths worldwide, yet it is also one of the most preventable and treatable forms of cancer if you catch it early. The problem is that the colon is a quiet organ. It's tucked away, and it's very good at hiding problems until they've had a head start. Most people wait until they are in significant pain to see a doctor, but by then, the window for easy treatment may have closed. Today, we are going to break down the warning signs you should never ignore, the subtle changes your body uses to scream for help, and why the prep everyone complains about is worth it. To understand the warning signs, you have to understand what's happening inside. Most colon cancers start as small growths called polyps. Think of them like tiny mushrooms growing on the inner lining of your large intestine. At first they are benign, meaning they aren't cancerous, but over years some of these polyps can transform. Because these polyps are small, they don't hurt. You can't feel them. This is why we call it a silent killer. However, as a polyp grows or becomes a tumor, it begins to interfere with the way your body processes waste. It might bleed slightly, or it might narrow the passage. This is where the signs begin. If you learn to read your body's signals, you can essentially catch a fire before it spreads to the rest of the house. Everyone has off days. Maybe you ate something spicy, or you're stressed at work. But a major warning sign of colon cancer is a persistent change in bowel habits. What does persistent mean? In the medical world, we generally look at a window of 2 to 4 weeks. If you have diarrhea that won't quit, or constipation that feels different than usual, pay attention. One of the most specific signs is a change in the shape of your stool. Doctors often look for pencil stools, stools that are very thin or narrow. This happens because a tumor in the lower part of the colon acts like a physical barrier, squeezing the waste into a narrow shape as it passes by. If your bathroom routine has fundamentally shifted and stayed that way for a month, it is not just something you ate. This next sign is the one that usually scares people into the doctor's office, but it's often misunderstood. Seeing blood in the toilet is never normal, but it isn't always bright red. If a tumor is located at the very end of the colon or in the rectum, the blood will be bright red. Many people dismiss this as hemorrhoids. While hemorrhoids are common, you should never assume that's the cause without a professional opinion. Even more dangerous is dark, tarry, or black stool. This indicates blood that has been partially digested, meaning the bleeding is happening higher up in the colon. If your stool looks like coffee grounds or black tar, your body is telling you there is an internal wound. This is a red flag that requires an immediate appointment. We all get gas and bloating. But colon cancer pain is different. It often feels like a deep, dull ache or a persistent cramp that doesn't resolve after you use the bathroom. Patients often describe a sensation called tenesmus. This is the feeling that you need to have a bowel movement, but even after you go, you don't feel empty. It's as if something is still there. That something could be a tumor tricking your body into thinking there is waste to be expelled. If you find yourself sitting on the toilet frequently with no results, or feeling a constant fullness in your lower abdomen, your colon is struggling to move things along a clear path. Some of the most dangerous signs don't happen in the bathroom at all. They happen in your energy levels. Because tumors can bleed tiny amounts over a long period, you can develop anemia, a low red blood cell count. You might not see the blood in the toilet, but you will feel the lack of oxygen in your blood. This shows up as unexplained fatigue. If you are sleeping 8 hours but feel like you've run a marathon, or if you get winded walking up a flight of stairs that used to be easy, your body might be losing blood internally. Coupled with this is unexplained weight loss. If you haven't changed your diet or your gym routine, but the pounds are falling off, your immune system is likely using all its energy to fight a growth, or the cancer is changing how your body uses nutrients. Weight loss without effort is never a win. It's a warning. Now let's talk about the specific nature of these symptoms. Many people confuse colon cancer signs with irritable bowel syndrome or IBS. While they share symptoms like cramping and gas, the key difference is often the age of onset and the progression. If you are over the age of 45 and suddenly develop these issues, the medical community treats it with much higher urgency. If you are listening to this and realizing you have one or more of these signs, don't panic, but do take action. Most people avoid the doctor because they are scared of the diagnosis or the colonoscopy itself. Let's clear the air. The prep for a colonoscopy is the only hard part, and it's just one uncomfortable night. The procedure itself is usually done under sedation. You wake up, and it's over. More importantly, a colonoscopy is the only test that can actually prevent cancer by removing those polyps before they ever become dangerous. The current guidelines suggest starting screenings at age 45, or earlier if you have a family history. Colon cancer is a fight that is won through time. Catch it early, and the survival rate is over 90%. Ignore the signs, and those odds change. Your body is constantly communicating with you through these biological signals: a change in color, a change in frequency, a change in energy. These aren't just inconvenience. They are data points. Listen to your body, talk to your doctor, and don't let a quiet disease have the final word. Early detection doesn't just treat the disease, it beats it.